Hello, I'm Shaylin Quinn, and today I'm going to be talking about a study conducted by White and his colleagues that compared four types of therapy for chronic fatigue syndrome. The authors ultimately wanted to know whether or not that the addition of adaptive pacing therapy, cognitive behavioral therapy, or graded exercise therapy to specialist medical care could create a more effective treatment for chronic fatigue syndrome. Before I go any further, I'll explain more about these therapies. Adaptive pacing therapy treats chronic fatigue syndrome by helping the patient to live and adjust to living with the disorder by prioritizing and pacing themselves in their activities. Cognitive behavioral therapy targets the cognitive fear of engaging in certain activities and the avoidance of that activity. Graded exercise therapy gradually increases levels of physical activity to return a patient to appropriate levels of physical activities. Lastly, specialist medical care offers a explanation of the disorder that they are living with, general advice, and medications for some of their symptoms such as insomnia or pain. White and his colleagues hypothesized that graded exercise therapy and cognitive behavioral therapy, when being added to specialist medical care, would have a greater effect than would adaptive pacing therapy, but they still hypothesized that adding adaptive pacing therapy to specialist medical care would be more effective than just being treated with specialist medical care alone. They used 641 participants who met the criteria for chronic fatigue syndrome. They randomly assigned them to one of the four therapy groups, and they ended with a sample that was 93% white and 77% women. So there was definitely a lack of diversity in the sample. After being assigned to a certain therapy group, they were under therapy for several months, and at the end, they recorded their own levels of fatigue and their own levels of physical functioning, so all outcome measures were reported by the participants themselves, and there was no other objective measure. The researchers also kept track of any adverse effects or reactions that the participants claimed to have had from the therapies. White and his colleagues found that graded exercise therapy and cognitive behavioral therapy, when being added to specialist medical care, created a more effective treatment for chronic fatigue syndrome. They found that adaptive pacing therapy actually did not create a more effective treatment and that it was no more beneficial than specialist medical care alone. They also found that any adverse effects that were reported by participants were uncommon or rare. So what does this mean? These findings suggest that clinicians should consider adding graded exercise therapy or cognitive behavioral therapy to specialist medical care when treating a patient with chronic fatigue syndrome. It also suggests that possibly clinicians should avoid using adaptive pacing therapy because it may be a waste of their time as well as the patient's. The study did have some limitations to consider when taking in the results. The authors excluded any participants who were unable to get to the treatment centers or the hospitals. So this means that some of the most disabled and severe cases of chronic fatigue syndrome were excluded from this study, meaning that possibly only the findings apply to those with mild to moderate cases of chronic fatigue syndrome. In addition, participants were not blind to what type of treatment they were receiving, as well as the therapists, who of course knew what type of therapy that they were applying to this patient. And at the beginning of the study, the researchers had the participants rate each type of therapy and how effective they thought it would be. So it's possible that the priming of this expectation may have led participants to go in with either more of an open mind or a closed mind, depending on what therapy they were assigned, and could influence their own reports of the outcome measures, which were fatigue and physical functioning. In addition, about 40% of the sample did have another psychiatric disorder in addition to chronic fatigue syndrome, and it's possible that the presence or the treatment of these disorders were impacting the results in a way that the authors did not take into consideration. So where do we go from here? Ultimately, this study proved that cognitive behavioral therapy and graded exercise therapy can moderately improve the treatment of chronic fatigue syndrome when being added to specialist medical care, but further research into other methods or other therapies that could be effective is definitely a good place to go from here. Thank you very much, and I hope you learned a lot.